Hi, I'm Chanelle, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast. Can I start with your name and your title?
Howard Quayle, retired Chief Minister.
Right. Now, Mr. Quayle, thank you so much for joining us today. Can you believe it's been 5 years, or close to 5 years, since we had the coronavirus pandemic?
Well, I suppose life goes on, but, and sometimes when you've had a bad experience, you try and shut it out of your mind. 5 years ago, the start of the pandemic, it was a traumatic time, not just for me, but everyone in government, everyone on the Isle of Man, especially the poor people that lost family members.
Leading up to this, I think it was the 16th when you made the announcement, that first briefing to the media, in the days leading up to that briefing. Do you remember the conversations? Do you remember the type of research that was going around and those big decision-making moments?
Yeah, well, obviously first and foremost, I'd been called in by the Chief Secretary and given the official government file on a response on how to handle a pandemic. But it was for a flu pandemic, and it was as much use as a chocolate fireguard, to be blunt, and we had to start planning for something totally different that the island just hadn't seen before. So there was a massive planning, trying to get the special strategic codes to set up a call centre, for example. We realised we were going to have to shut the island down, but you can't just shut an island down like that. You have to take into account people who are off island in hospital maybe or on holiday. You have to give them notice. There was a vast array of things that had to be done. And then at the time it was found that to help treat COVID, oxygen being pumped in through the nose was a key, it benefited people, shall we say, and we shipped at the time our oxygen onto the island. So then we had to plan, well, if things got really bad in the UK, we couldn't not have oxygen if the tanker wouldn't come over, because a tanker would have taken 4 hours one way, drop off, and then 4 hours back. It could have serviced 3-4 hospitals in the UK during that time. So we bought the last oxygen generating plant going in the UK, and if I had to run and see the Treasury Minister and say, pay this bill now, because otherwise if we don't, that plant will go to Nightingale London and not to the Isle of Man. And then so we had the plant coming, but we didn't have a shed to store it up at Noble's Hospital. So then DOI and Council of Ministers, we met every day with the DOI going through how's shed erection coming along, so that when the specialist plant arrived, we would have a shed to put it under, and we fitted a oxygen generating plant in record time. We set up a call centre in record time. So it was pretty stressful and full on, and obviously trying to get the support to shut the island down as well, which had never been done before. So an interesting time, shall we say.
How did you, because you essentially were at the time the leader, you were the person that people were looking at for advice, for comfort, for support, everything, because it was very worrying times. How did you at that time, because you're also very privy to lots of information, how did you keep it all together? Because it was lots of unknowns.
Well, I had a good team around me. It wasn't all me. I had a good team. The Health Minister, David Ashford, was incredibly supportive. I had the Director of External Relations, who was ex-Foreign Office. In fact, that's where he is now. I saw a good team, the Chief Secretary, all the chief officers of, especially from the health side of things. So I had a good team helping me, and we worked together. I knew from day one it was incredibly important that we held regular updates to the people of the Isle of Man to let them know what was going on, because we were only finding out information. I mean, some days I would go to do an interview, and just before I was about to do it, something would change and I'd have to alter my speech. So I thought it incredibly important that we did these briefings so that the public knew what we knew, and we could try and explain why we were making certain decisions, because we made pretty decisions that I would never have wanted to make in my lifetime, stopping people from going to see other members of the family, stopping people going out for a drink to see, we shut all the nightclubs, pubs down on the island. It was decisions that you would never have wanted to have made, but hindsight has shown that they were the right decisions.
What was your biggest or main focus at that time in those initial stages?
Well, I had a pretty horrible thought process from our medics about what could happen, and they told me to expect up to 2,000 deaths in the first few months. Now, if you're the chief minister of your island and you're told that you could face losing 2,000 people in the first couple of months of the outbreak, that's a pretty horrible thing to be told. And I did my utmost working with the team to ensure that that didn't happen. And in fact, just before, whilst any death was it was one too many, I think just before I retired in about June, July, we'd only lost 33 deaths, 33 people, and that was 33 too many. But compared with the 2,000 I'd been told to plan for, it was a huge relief to me that we had managed to keep it so low, but still terribly upsetting whenever it was reported to me that someone had tragically died. But you do look at the average age of the deaths on the Isle of Man was 83. A high percentage were of people sadly near the end of their life. But that was probably the toughest, knowing that your people were could die in a significant number, and being responsible for that and trying to combat the illness so that you didn't have that high number.
How important was transparency at that moment? Because life changed for people, and then you went into these briefings, daily briefings. How important was having that transparency for people to listen in, and even just having to deliver that we've got 13 new cases on island, we've got our first death today. How was that?
It was pretty daunting. I wouldn't have said I was a natural, but you have to sink or swim, and I knew it was incredibly important that the public were kept up to date with everything that we were doing to reassure them. And funny enough, I remember a big burly builder coming up to me to say he wanted to discuss COVID with me. And I thought, oh dear, what's happening here? And he said that the briefings kept his wife, who was heavily pregnant at the time, saying that she had been really stressed with the COVID pandemic in general, but the fact that they were getting a regular briefing at 4:00 reassured her that her government was in control, was doing its best, were trying to their best to answer the questions. We didn't hold back, and that was nice feedback that it was appreciated from the public. On the whole, you're never going to please everyone, but on the whole, I think the briefings that we gave the public were well received by and high percentage of the population were listening.
How do you think the island handled the COVID pandemic?
Well, I think you're never going to be perfect for something. Mistakes were made. I'm glad we had the review because it clearly showed areas. I wouldn't want another chief minister to go through what I and my team had to go through. So it was really important that we had the review to say, well, what did we do well? What did we do okay? And what did we maybe not do so well? And where do we need to improve? So that when a chief minister picks up the folder on how to deal with a sort of a COVID variant, say, in the future, they're far better prepared and can move so much quicker and not have to do everything from scratch, if you know what I mean. So some things we got right, some of the other things we didn't get right, but if you analyse the data, when you look at the review, for example, it shows that I think the Isle of Man was second only to New Zealand from a death rate point of view. It was incredibly low, 140 odd, far too many, but much lower than anywhere in the adjacent isle. The cost to the public on how we handled COVID, I think we came in at about £2,300 per person. I think the UK was £4,600 to £6,000 per person, and there was nowhere in the British Isles, even our fellow Crown dependencies, who you could say you're comparing apples with apples, had spent more and had a higher death rate than ourselves. So from that point of view, we did okay, but there were other areas that I felt we could have done better. And that's why I'm glad we had the review, because, for example, the support of residential nursing and nursing homes, that obviously was clearly shown we hadn't got it quite right. Again, the transportation with the steam packet, mistakes were made there. So it's good to have a review. It's, I'm happy to admit that we weren't perfect. We did our very, very best. The review into COVID shows that the Isle of Man did exceptionally well compared with the rest of the world, but there was still room for improvement.
I know you're no longer in politics, but what's your view? How has the island recovered since then?
Well, I suppose the island's got back to normal. One of the things I was particularly proud of during COVID was how the people of the Isle of Man pulled together and helped one another. And you had organisations maybe helping elderly people who couldn't get out to shop or were vulnerable with their health and didn't want to go out to shop in case they caught something. And you had organisations going and doing the shopping and just dropping it off at the front door. And that sort of community spirit, it was very moving. Little girls painting rainbows on pebbles and selling them to raise money for the COVID support to members of the public who were having a tough time. Just little things like that. Incredibly moving, and I was incredibly proud of how everyone on the island just helped one another. And if I'm sad in a way that I don't see that continuing as much, as an ex-president of the Farmers Union, one of my biggest problems was ensuring that we had enough food supplies for the people of the Isle of Man. The fact at the time we were self-sufficient in bread, in cheese, in milk, in beef and lamb was incredibly important. Obviously, maybe not toilet roll, which everyone will remember the hysteria of trying to locate some supplies, but we kept everyone going. Also PPE with the island, we knew that with the UK having major problems, we couldn't, whilst they were supposed to provide as part of our agreement with PPE, we knew we couldn't rely on them because we were sort of the end of the line. And if they couldn't have enough for their own hospitals, were we going to get adequate supplies? So because of our manufacturing sector on the island, which was based around the world, we were able to use contacts and leverage and get our own PPE. So the Isle of Man never went short of PPE. And one of my things that I was really happy with is that the team managed to ensure that we didn't lose any of our health workers through getting COVID as a result of not having the PPE, which sadly happened in the UK.
Right. As you were saying that, it actually did click to me. Because it's an island that's so reliant on things being brought in, it must have been even tougher for you to say, okay, we need what we normally get. We need twice or 3 times or 5 times more of that. You have to be able to foresee what you're going to need, not even knowing with exactly how rough, what the timeline would be. Yeah,
well, you had to take into account panic buying. People would panic buy certain items. So hand sterilisation and toilet roll were the biggest concerns of some of the supplies. But obviously you were worried that what was going to happen if the UK had a total meltdown and you couldn't get supplies to the island. So you were having regular conversations with the suppliers of food and supplies to the island. And obviously, fortunately, the government had bought the steam packet. So we were able to say that even though no people were coming over, the boat would sail to bring supplies over so that the people of the Isle of Man were continuously supplied with food and clothes and all the things that we don't produce on the island.
Okay. Something that I started reading up about it, but I think I got distracted. Howard's Heroes.
All right. Well, it started off with the public started to call the briefings at 4:00 Howard o'clock.
Right.
And then an organisation started to do merchandising to raise funds for the COVID fund. And then I was so impressed with what individuals and organisations were doing around the island to help that community spirit that I thought there should be some form of recognition. So for a while, I mentioned the young girls painting the rainbow to raise funds for the health service and for the COVID fund. So Ramsey, I'm a founder member of Western Vikings. I used to play for Peel, and the old competition was always Ramsey, Peel and Ramsey. And bless Ramsey, they set the rugby club there set up a delivery for the elderly and vulnerable people of food, supplies, etc. And I just felt that should be acknowledged by government, that members of the Manx public were going above and beyond. Yes, people were helping their neighbours, but we had other people who really were going above and beyond. There was a chap who did a marathon and to raise funds. So, yeah.
During that time, did you have any words of support or any words of comfort for those emergency services, those people in the hospital, your police officers, all your frontline workers, or if you shared anything with them at the time, or what would be your message to them now?
Well, I think they did a fantastic job. I'm sure across the world, all the medics, the police, the steam packet staff who got our supplies and brought our people back, everyone did their best, and I was incredibly appreciative. And I know during my speeches I used to thank our people, whether it be the health service workers, or I would focus on an area where something was happening and thanks. So I think it was important to recognise the work that our organisations did, but equally there were people who weren't healthcare workers. I know if you went up to have the swabs to be tested at one stage, you went up to the grandstand, the TT grandstand, and we had our Year 2 nurses were doing the swabs, but also you had a steam train driver helping corral people for the test. So everyone was doing their bit, if you know what I mean. And I always tried to thank these people, and I know I wrote lots of letters to people who'd had to carry on working, because not everyone could work from home. And it was a team effort. And as I say, whilst it was a very traumatic time, I was incredibly proud of our people, the people of the Isle of Man, and how they responded. They followed the rules. Yes, we were fairly strict if you did break the rules, but the vast majority of people followed the rules. And as a result of that, they had a significant period where the Isle of Man was the envy of the world, where we could continue with our lives. I know I did numerous interviews around the world because we were the first to open up. But yeah, we were lucky that, as I say, the people of the Isle of Man, our government workers, our healthcare workers, but not just them, everyone stepped up to the mark. And as a result, we came out of it much better than initially I thought we might do.
Earlier we spoke about transparency and having those briefings. How difficult was it when you had people on social media? Did those briefings help? Did that transparency help deter people from all of those social media keyboard experts?
It did in a way. Doing the face-to-face effectively, speaking to the people of the Isle of Man really helped, because people could decide for themselves whether they liked what I was saying, whether they agreed with what I was saying, but at least they were hearing from me, not secondhand or from someone who was twisting your words. So if I messed up, it was my fault. I could take that on the chin. I needed to do better. But there was nothing worse when someone twists. There's a phrase from Rudyard Kipling's poem, if you can bear to hear the words you've spoken, twisted by knaves to make a trap for fools. And therefore, doing the live briefings every day, the public could decide for themselves, based on what I was saying, whether they got the information that I had firsthand. There was no one able to twist what we were putting out. And I found that really, really helpful. And I was retiring. I'd always said I was retiring at the end of that term. But had I stayed on, I would have ensured that if I'd stayed on as Chief Minister, I found it incredibly important and beneficial to be able to speak directly to the people of the Isle of Man. They might not like always what I was saying, but at least they could hear it from me. They could hear the questions being asked as to why and the reasons. And I brought in different members of the team too. The health minister was there a lot, and I tried to bring in different ministers if we were covering an area that was relevant to their portfolio of responsibility.
Do you remember the moment that you were informed of that first death, or what went through your mind, what that feeling was like, or even having to deliver that news, or any of the...
Yeah, it was terrible. You knew it was coming. You hoped it wouldn't happen, but you knew it was coming, that it would happen. We couldn't be the only place in the world where there was no deaths. But it was a sense of dread in the back of your mind. But things were moving so quickly. Every day something was happening that you had to plan for, that you were able to push it to the back of your mind. And I think when it first happened, it was incredibly upsetting. Funny enough, the governor asked could he be part of it, and we did a joint press release that time to sadly announce that we had lost a member of the Isle of Man community. I'd just like to say that this was a massive team effort, and I'm incredibly proud of the people that were around me advising me, but also the people of the Isle of Man for everything that they did to ensure that the Isle of Man came out of this as well as we did. Yes, mistakes were made. We were making this up as we went along, trying to do our best for the people. And I hope the next administration that has to deal with this will be able to learn from our mistakes, because we've had it all documented. We've had a full report and review of how we handled COVID, so that the next Chief Minister in the future doesn't have to start from cold. But I'd just like to thank everyone involved, the people of the Isle of Man who followed the rules and enabled us to have such a good outcome compared with the adjacent isle where maybe it hadn't gone so well.
Right. Can I start with your name and your title?
Yes, Alfred Cannan, Chief Minister.
So, Chief Minister, it's around this time 5 years ago that discussions around measures started taking place around the coronavirus and the pandemic. Can you tell us about that?
It's incredible to think that was 5 years ago. But I remember it very clearly. I think in my evidence at the time that I gave to Kate Brunner, I said, the weeks preceding it had been like watching a slow-moving train crash in terms of the train coming down the line towards you. And, I remember sort of waiting at the time for the UK to act, and as things became more and more clear that the virus, it was inevitable that the virus was going to hit the island, the level of activity increased until the day, of course, that Council of Ministers and Howard Quayle decided that they were going to enact emergency powers, and of course life changed immediately for everybody on the island.
Now, at the time you were the Treasury Minister, how difficult was it for you? You had to make those decisions around the economy and still ensure that it was stable enough for everybody.
Yeah, so, I remember going out the week before the 23rd of March with a package of measures. I think the cost of that was about £40 million. And I sat down and I sat in the House of Keys and, walked out, and I just knew almost as soon as I'd sat down that was never going to be enough. And actually, the next 7 days were frantic. We got together, Treasury, Department for Enterprise. I brought together senior executives from business and industry. We had working groups, so we worked all weekend. And then on the 23rd of March, I stood up and announced the initial £100 million worth of support packages. So it was, a very fast-moving, eventful time. And of course, as the days were going by, the sense of panic, I suppose, in amongst those in the business communities, the lack of vision for many other people as to what was going to happen became more and more apparent. I think after the 23rd of March, when we got that support package out and signalled, the absolute intention for everybody to stay at home then, and that we were effectively going to lock down the island, things obviously started to take more shape, and I think we soon got into our rhythm and routine. But yes, that week leading up to the 23rd of March was pretty frantic, very busy, and resulted in that first significant package of measures being announced, and they were very much the foundations for which we operated for the next 2 years.
Do you still remember those initial meetings and fears and feelings that went through your mind, or thoughts that went through your mind in those first few days?
Yeah, because I think for everybody, including myself, the uncertainty about the virus, coming to terms with the reality of it, what was fact and what was fiction. And I remember sitting in the Council of Ministers meeting, and we were questioning the medical professionals. And I must have been the medical director, I think, said, look, very much this virus will incubate over 21 days. And I remember the question being put, so basically if everyone stays at home for 21 days, the virus will disappear off the island. And the simple yes to that really formed the basis of the strategy going forward. And I think, things started to become clearer then, and then you added on top the financial packages and the fact that actually, things did work, that once people went home, once we got control, and the community brought into that in such a huge way, that we managed to get ourselves back into a regular way of life and free of the restrictions at quite an early stage. And I guess enjoyed a long hot summer as it turned out in that first year.
How has the island recovered since then?
It's really hard to say, because there was certainly disruption caused by COVID. It had knocked the economy. I think it did knock businesses. There were a lot of people who, for whatever reason, I think decided to change their lives after or during the pandemic, whether those were individuals who were looking to retire and perhaps decided to exit from the workforce earlier than intended, or individuals who just simply changed the way that they viewed the world and the way that they were going to either socialise or travel. So there have been impacts, and certainly exiting COVID, and that was the first job of this administration. So and that was little more than sort of 3 years ago. Exiting COVID was, of course, key, and getting the economy moving again. And of course, we then went straight into almost the crisis that evolved out of Ukraine. So, yeah, it's certainly been a hard road, I think, since COVID.
Is there anything that you, looking back, is there anything that you would have changed or would have done differently?
Look, there were always bits and pieces that you look back, and I think perhaps I wish we had acted maybe a bit earlier, hadn't been so reliant on the UK. But look, we've been through all that, I think, with Cape Brunner. It was a difficult time. My absolute reflection, though, incredibly privileged to hold the position I did at the time in Treasury Minister, was that we did come together. The island came together. That we did make the right decisions, as Cape Brunner has indicated. And it's tough. There was lots of people with different memories, and some obviously with different views. And actually, I wish it had never happened. I wish we hadn't gone through that pandemic in such a way that it caused so much damage to business and individuals. But it's really, hindsight's a wonderful thing, but I think I still stick by what Cape Brunner found, and I think the evidence that I felt at the time was that, once government had got a grip and the island had bought into that and everybody came together, we as a community did really well, and we should be proud of that, although, it has left a legacy.
What have we learned from it? And looking forward, where do you think we're heading?
No, I think we have to stay focused about the threat of pandemics in the future. We obviously see illness and viruses come and go. Obviously, nothing on that scale. I think certainly for the immediate years ahead now, the world will still have good memory about the virus and will be in a position to react, I think, should it ever occur again. And probably be more effective in dealing with it. But that threat will never go away. We should never be complacent about the fact that the island man may have to deal with emergency situations. And I remember living for years on the island and asking government about its preparedness and is it ready to go. And I think there's always a bit of a laissez-faire attitude, not just in government, but perhaps broadly across the island. Oh, we will never need to be, in that position, or we will be looked after. Actually, I think COVID showed us that, we're facing the ultimate crises. You're on your own, and you have to make those critical decisions. And so I hope, we will be more alert and aware. And in some ways, actually, I feel it's helped us have a more mature approach and understanding of the value of our borders and the need to look after them, and keeping ourselves alert to what is going on globally.
Can I start with your name and your title, please?
Yeah, so David Ashford, now Minister for the Cabinet Office, but at the time of COVID was Minister for Health and Social Care.
Right. Now, David, looking back 5 years, let's start with, can you believe it's been 5 years?
I really don't know where the time has gone. It has absolutely flown by. It is absolutely crazy to think that those days were now basically half a decade ago. Time just flies by, and it seems to get quicker day after day.
And when the pandemic started, can you remember those first few days? Or even before the island started discussing it with the residents, can you remember those first few meetings that you would have had internally?
I can. I remember them quite vividly, to be honest. It was around dusting down plans and actually seeing what we did have. Obviously, news was flooding in quick and fast around what was happening around other parts of the world, and the news that was coming out of China and the Asian countries and then into Europe. In those days, there was a lot of uncertainty around how virulent COVID actually was, what the impact was on community health. There was lots of contradictory information as well, and we needed to try and make sense of all that and work out what we were going to do, because although we are a small island in the middle of the Irish Sea, it was obvious from what we were seeing around the world that at some point or another it was going to impact on us.
Right. And do you feel, that we have since recovered, or are we still in that recovering phase of COVID? I'm sure it's still fresh on people's minds.
I think there is still hangovers from COVID. I think the island has been very resilient. And in fact, to be honest, we bounced back a lot quicker than other places because thanks to the amazing response of our island community, it's easy to forget we only actually spent 12 weeks of 2020 in any form of lockdown with restrictions. For the rest of 2020, we operated internally anyway, certainly internally with border controls as normal. So we didn't have social distancing, whereas most places in the world, they went through 12 months or more of social and societal restrictions. We didn't actually have that. So we were in a very much better place thanks to the way that the island responded and its people responded than a lot of other places in the world.
Right. And I know, during the time you were one of the people that were at the forefront, in terms of public engagement and, updating people. I mean, you were the health minister at the time. Did you have time to chat with some of your doctors? What was going on in the background in terms of healthcare?
Yeah, so I mean, obviously, it was a very interesting time to be Minister for Health and Social Care. That's certainly the way I think to put it. No one could have expected what occurred. Obviously, there was constant communication, not just with myself, but other ministers as well. And we've got to say as well, there were varying clinical opinions as well. It's not correct to say that there was one opinion from even the clinical body. There were different clinicians with different views and takes, as you would expect in something like this. So again, sometimes you have to wade through different characters and different opinions to actually decide what you were actually going to do.
And looking back now, is there anything that you would have done differently, or that you would have changed, or anything like that?
Well, hindsight is a wonderful thing, as the old phrase goes. I think actually, well, I personally, and I actually pushed for it at the time, would have actually shut us down earlier. As we now know from Freedom of Information requests that have released the minutes, I went to Council of Ministers in the March requesting that we actually impose a shutdown then. That wasn't supported at the time. For various different reasons, with people feeling that we should hold off and there was other things that needed to be done first. That's the one thing that, from my point of view, I think we should have done, is that we should have shut down slightly earlier. But equally, we've got to remember this was something the world hadn't seen since the Spanish flu outbreak 100 years before. So it had been a century since the world had ever really dealt with something on this scale. And the world had moved on massively since then, but in terms of people's movements, in terms of the way we travel. The Spanish flu outbreak was basically transmitted an awful lot by troops returning from the front lines after the First World War and returning to their home countries. This time round, we can jump on a plane and be somewhere within 24 hours the other side of the world. So things have radically changed, and that means as well that when it comes to viruses and things like COVID, they can spread much more rapidly. So we are living in a different world, and I think now it has changed the way that we think of public health as well, and the way that we actually do things. So hindsight is a wonderful thing, as they say, but I think one of the things COVID has done is it has left not just us, but the rest of the world as well, better positioned and better prepared should there be a similar outbreak in the future.
And that was going to be my next question. Are we, or do you feel that if anything, touch wood, if anything had to, happen in the future, we would be a bit more better prepared to deal with it?
I think we are. I think, like I say, the rest of the world is as well. But it is important to caveat it with, you are still trying to guess the unknowns. If there is another pandemic at any point, the virus you're dealing with might be very, very different to COVID-19. It might actually react in a different way. It might spread in a different way. And, how it actually affects people might be completely and utterly different as well. So, you've got to be able to plan for the high level stuff, but a lot of it will be subjective upon what actually comes at you at the time. So there will always be the unknowns. But I think that the world and the island is in a better place to be able to deal with that than we were at the start of COVID.
No, definitely. And I know, looking back, when you hear people talk about the COVID days, you hear some of the funny stories. You hear, an alcohol company was making sanitizer on the island. But you also have to reflect, lives were lost as well. And I'm sure approaching the anniversary or even, still saying those words, coronavirus, it still impacts some family members who would have lost loved ones.
It does indeed. I mean, it was a sad moment in many respects for many in our community. And we mustn't forget as well, there was a real level of fear out there as well. There was lots of vulnerable people that were impacted. We did tragically lose members of our community to the virus, and that mustn't be forgotten. There was the more light-hearted stuff you mentioned as well, and the island really pulled together. And I think what I take away from COVID is, and something I'm still exceptionally proud of, I said I was proud of it at the time and I still am, is the way we came together as a community on the island. People looked out for one another. People checked on their neighbours. They made sure that they had everything they needed. They looked after the vulnerable in our society. And I think, in memory of those that did lose their lives in COVID, if there's one thing that can be taken from it that we should try and retain here on Ireland, it's that community spirit. We should be exceptionally proud of the way we reacted as a community to that and what we actually managed to achieve as a result.
If you look at the other countries around the world, in terms of their is it morbidity rate, in terms of their
Yeah, the
rates,
mobility, yeah.
if you look at their rates, the island actually did pretty well. And I'm not trying to say, oh look, there were so many deaths here and not here, but the island did do well in terms of protecting its people.
We did. I mean, obviously, any death is one death too many. But compared to other areas of the world, the fact that we did shut down and we did manage to actually close the borders allowed us not just to be able to operate, as I said, for most of 2020 internally anyway, as an ordinary society, but equally it did actually reduce that potential death rate. There were a lot of vulnerable people on the island who, if we had had the widespread outbreaks seen in the UK or elsewhere, could have been at serious risk. And that was where we always came from with COVID from day one, when we decided upon the measures that we wanted to bring forward. The view of the government was always it was around life preservation at the end of the day, and ensuring that as a society we tried to preserve life as much as possible.
What do you think we the Isle of Man, the residents, the politicians, everyone on the island has taken from COVID? What have we learned?
I think that goes back to what I was just saying before. That I think one of the big things we've learned is that as a nation we are resilient, and that we can do things differently. Because when we started with COVID, because this was something unknown, because this was something that we weren't really, 100% sure where it was going to go, we began by following the Public Health England advice. So we were following what the UK was doing to begin with, because with the best will in the world, on an island our size, we don't have the technical expertise that the UK does, and we will never be able to reproduce that. But it got to a point where we were looking at what the UK was doing, and to us, it just didn't make sense. And we didn't feel that was the right direction, that it was the direction that was going to best preserve life on this island and also do the best for our community. And so we took a different tact. We changed our policies. Now, that was a gamble. It was a risk. If it hadn't worked, I'm sure there would have been a huge amount of criticism levelled, not just at government as a whole, and also those of us who were politicians at that time. But I think what it shows is, as an island as well, we shouldn't be afraid to be brave and do our own thing. If we believe that something's right and we don't believe the other way, following someone else is sensible, we shouldn't be scared to actually say, no, we're going to do things differently. And I think that's one of the key things I draw from COVID. We did things differently. And as a result, we had a very different experience than most of the rest of the world. We are in the top, 5% of the world in terms of the length, the shortest periods of lockdown in 2020. We are one of those few nations that actually spent most of 2020 internally within the island bubble, living normally without social restrictions and without social distancing. There's not many nations in the world that can actually say that. And so, like I say, the way we pulled together as a community, we should be exceptionally proud of that.
At the time, how did you encourage, or how was it for you? Was it difficult for you to encourage your healthcare workers, your doctors, to keep pushing and keep doing what they were doing under all of the strain and the pressure and everything that was going around in the world?
I mean, I've got to say, whatever words I say will never, ever be able to do justice to the sheer amount of hard work and recognition that these individuals undertook and the recognition that they deserve. Our healthcare workers, in fact, all of our frontline workers, and by frontline workers, I mean those who continued to actually provide services to our community, such as those in retail, such as those who are taxi drivers, and other areas. They, and those obviously in our emergency services, they were, some of them, very vulnerable people themselves who were still out day in, day out, ensuring that we could function as a society. And particularly in health, those frontline healthcare workers, some of them actually even moved out of their family homes they actually did that in order to protect their families. So not only were they worried and, quite rightly scared themselves, but they actually separated themselves from their families. And I think, like I say, I can never, ever pay enough tribute to them and what they did, because it is thanks to the work they did on the front lines that we actually were able to get to the position that we did.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.